So, John, do I have your permission to videotape this assessment and share it with my kinesiology 6302 course?
Yes.
And do I have your permission to share this with my classmates?
Yep.
Very good. So John presents to us with some hip pain, mostly on the left, but also a little bit on the right. Complaints of some pinching, complaints of some pain anteriorly, kind of in the groin area, again, specifically on the left side. So John is a hockey player. This has been a bit of an ongoing thing, but more recently, John's not playing hockey because of the pain. And so we're going to go through a quick assessment of different structures in the hip and see if there is either musculoskeletal stuff going on or possibly even some mechanical stuff with impingement. So to start, we'll go through the uninvolved side, and we're just going to go through some gentle range of motion and just checking capsular feel, and we're just going to see how the quote-unquote good side moves. And we'll look for impingement signs in all these different positions. So we kind of progressively go into a little bit more internal rotation, a little more external rotation, all the way through his available range. And then we'll go to sort of a terminal hip flexion. Any pinching or pain with that, John?
Just tightness.
Okay. Where do you feel that tightness?
Front.
In the front, okay. And then we'll go into an anterior impingement test, so internal rotation and flexion. Any pinching or pain with that?
Pinchy there in the front.
Okay. And then we'll just check terminal external rotation and terminal internal rotation. Pinchy. Okay. But within normal limits, range of motion wise. Tighten your leg here for me. Raise up off the table. Hold right there and don't let me win. Don't let me win. Hold, 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 hold. Good. And relax again all the way for me. So everything for the most part, with the exception of some anterior impingement positive testing, looks fairly normal on the right side here. And let's actually do one more quick one on your side for me, if you would. On the left. And let's go into a little extension. This is going to be an Ober test to check and see if we have tight IT band or TFL. So stabilizing at the hip and just letting that leg lower to the table. And I would say he's a little tight through his IT band or TFL. Back to your back. One more thing for me, John. Cross this leg over here. Let's just check and see how far the knee goes down to the table. And this is Faber. So we use our fists to measure about 2 fist widths. Okay. Check on the other side. Same thing. We'll go through some gentle passive range of motion. Circumduction going into hip flexion. And already I can feel some tightness, restrictions, especially into internal rotation. Deep flexion, any pinching or pain or tightness in there?
It's tight.
Tight.
Not pinchy though.
Okay. And then we'll go into flexion and internal rotation.
Pinchy.
Pinchy in the front. Okay. And we'll just check terminal internal rotation with that. And significantly less left compared to right. And external rotation is about the same from left to right. Okay. Straightening out here. Tighten your thigh muscle here. Raise up off the table. Hold right there. Don't let me win. Hold, 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 hold. Don't let me win. Any pain up front with this?
No.
Okay. And then we'll go into the Faber test while we're here. And let that knee drop down to the table if you can. Any pain with that?
No, just tight.
Tight. Okay. And left to right, we're at least 2 fists plus a thumb, so definitely some limitation with that. And the last one, flip to your right side. And again, we're going to check IT band, TFL tightness. Stabilizing at the hip, letting that leg drop. Sometimes we check the knee bent. I'm going to say about the same left to right on that one, but still tight. So stand for me. John, if you would, this is the last thing we're going to go through is a Thomas test. This is checking hip flexor tightness. So sitting at the edge here, grab behind the left knee and roll all the way back. Let that right leg just dangle. relax as much as you can. Is that tight up and through
Yeah.
the front of the hip?
Yep.
So I'm going to call that a positive Thomas test. And then switch. Stand up for me if you would. Grab behind the right leg and roll all the way back. Tightness there, same spot?
Yeah. A little
Okay.
tighter.
A little tighter. So another positive test for Thomas test position. So hip flexors we're suspecting are going to be a little tight, and you can relax for me, John. So I would probably go through some palpation just to check other structures, glutes, hip flexors, to see how much tenderness we have with palpation, if there's any trigger points. For John, I'm suspecting some manual therapy to be in his future. We really want to try and loosen up some of those structures. More so than that, I have concerns with some impingement signs, especially on this left side. Positive tests with not only anterior impingement, to some extent staunch field and Faber. Those three positive tests make me want to send John to have this take a look at a little closer with maybe ortho. But we'll see how we treat, or we'll see how he responds to treating conservatively. I think manual therapy, joint mobilizations, we'll try to just kind of get him a little bit better palliative treatment, and we'll just try to make him feel a little better, combined with some strengthening and then possible ortho. Thanks, John.